So immune surveillance is a phenomenon in which natural killer cells continually patrol the body and look out for pathogens and diseased host cells. The natural killer cells are going to attack and destroy bacterial cells, cells of transplanted organs, cells that are infected with viruses, as well as our own cancer cells. They recognize the enemy cell. The natural killer cell will bind to it, release these proteins called paracrines that act in a similar way as we've seen before by creating a ring that basically punches a hole in the plasma membrane. They secrete a group of protein-degrading enzymes called granzymes that enter through this pore and degrade the cellular enzymes of the enemy cell and induce apoptosis. Here's the scheme. Natural killer cell here binds, releases these paracrine proteins which assemble in a ring and punch a hole in the membrane. They release then their granzymes and pour them inside the enemy cell. These granzymes will degrade all the enzymes of the enemy cell so it can no longer function properly. So it dies in the process of apoptosis. And then a macrophage will come along and engulf and digest the dying cell. So fever is an abnormal elevation of body temperature, but it has some really important functions. It can also be called pyrexia or febrile. It results often from trauma, infections, drug reactions, from brain tumors, and several other different causes. But it's an adaptive defense mechanism, and in moderation it does much more good than harm. Historically, people have used antipyretics or fever-reducing medications like aspirin when fever's onset. However, it's found that people who don't interfere with the natural course of a fever recover more quickly and are less infective than those that do. That's because fevers promote interferon activity. They elevate the metabolic rate, which accelerates tissue repair. And the additional heat inhibits reproduction of bacteria and viruses. So it's advisable to stay away from antipyretic devices when we're experiencing a moderate level of fever. In fact, in children, using antipyretics can create a very dangerous situation. Rye syndrome is a serious disorder in children we see younger than 15, where an acute viral infection like chickenpox or the flu can cause the swelling of brain neurons and fatty infiltration in the liver and other viscera. The swelling of the neurons creates pressure in the brain, which results in nausea, vomiting, disorientation, seizures, and coma. And sometimes, of course, these are the symptoms of a fever themselves, so it's hard to tell that this is happening. 30% of these children die, but survivors who don't die sometimes suffer mental retardation, and it's most often triggered by the use of aspirin to control fever. So never give aspirin to children with chickenpox or flu-like symptoms because it could bring on Reye syndrome. So a fever has a natural course and can be elicited by exogenous pyrogens, which are fever-producing agents. Glycolipids on bacterial and viral surfaces can turn it on. Attacking neutrophils and macrophages will secrete chemicals like interleukins and interferons, and others that act as endogenous pyrogens. So sometimes the fever is elicited from the outside, but then endogenous pyrogens turn on the fever on the inside. These can stimulate neurons in the anterior hypothalamus to secrete prostaglandin, and that raises the hypothalamic set point for the body temperature, which allows these different stages of fever called onset, stadium, and deeffervescence. Here's the way a fever works. We have a normal body temperature around 37 degrees Celsius or 98.6 in Fahrenheit. When we see that there's infection, then there's pyrogen secretion. The pyrogens, heat-creating substances, will increase the body temperature. The hypothalamic thermostat is set to a higher set point, and then the temperature will oscillate around this set point until the infection ends. When the infection ends, the set point will return down to the normal level. This stage is called de-effervescence, where the body temperature returns to normal and oscillates around our normal set point. So our final non-specific defense is inflammation. It's a local defensive response to tissue injury of any kind, including trauma as well as infection. The general purposes of inflammation are to limit the spread of pathogens and destroy them, as well as removing debris from damaged tissue and then initiating tissue repair. There are 4 cardinal signs of inflammation: redness, swelling, heat, and pain. Anything that ends in the suffix itis denotes inflammation of a specific organ. For example, arthritis is about the joints. Pancreatitis is about inflammation of the pancreas. Dermatitis, inflammation of the skin. There's a whole class of chemicals that regulate inflammation and immunity. They're called cytokines, and they're secreted primarily by leukocytes. They alter the physiology or behavior of the receiving cell and act at short range, either to neighboring cells or to themselves. So a cell can secrete cytokines that act on itself, and it's called an autocrine. And if it's secreting a cytokine that is for a neighboring cell, we'll call it paracrine. These cytokines include chemicals like interferon, interleukins, tumor necrosis factor, chemotactic factors, and some others. We won't get too much into the detail of each of these substances, but just be aware of this whole class of cytokines. Now we'll look at the processes of inflammation. There are 3 major processes. First of all, mobilizing the body defenses. Next, we've got to contain and destroy the pathogens, and then have to clean up and repair the site. So to the bottom line, we must get the defensive leukocytes to the site quickly. And that's going to happen by increasing blood flow to the area. It's called hyperemia. Local vasodilation happens because of vasoactive chemicals like histamines, leukotrienes, and some of the other cytokines. So they actually act to increase the diameter of blood vessels, so we have more blood supply at the site. These chemicals are secreted by basophils and mast cells that have been damaged by trauma, toxins, or other organisms, microorganisms, that might trigger the inflammation. The hyperemia washes the toxins and metabolic waste away from the site much more rapidly, as well as delivering the leukocytes to the site. As the vasoactive chemicals dilate the local vessels, we'll see that the endothelial cells separate, which increases the capillary permeability. So fluid, leukocytes, and plasma proteins can now more easily leave the bloodstream. Among the helpful proteins in here are complement proteins, antibodies, and clotting proteins. Selectins are cell adhesion molecules. They're made by the endothelial cells, and they aid in the recruitment of leukocytes. It makes the membranes more sticky, and it snags the leukocytes and holds them in place. This adhesion of leukocytes to the selectins that are on the vessel wall is called margination. Now that the leukocytes have been selected, they can crawl through the gaps between the endothelial cells and enter the tissue fluid. This process is called diapendesis or emigration. So all 4 of the cardinal signs of inflammation can be explained in the process of mobilization of defenses. The heat results from the hyperemia. More blood in the site, more heat. The redness is also due to hyperemia, as well as the extravasated red blood cells in the tissue. That is, the red blood cells that have escaped the vessels. The swelling is edema. That's due to increased fluid filtration from the capillaries. They've got extra space for fluid to come out, then we're going to see edema. The pain is from the direct injury to the nerves, pressure on the nerves from the edema, and stimulation of pain receptors by prostaglandins, bacterial toxins, and a particular kinin called bradykinin. So now that we've mobilized the defenses, the next stage is going to be containment and destruction of the pathogens. One of the priorities of inflammation is to prevent the pathogens from spreading throughout the body. Fibrinogen that filters into the tissue fluid forms clots, a sticky mesh that walls off the microbes. Heparin prevents clotting at the site of the injury. So pathogens are now in a fluid pocket that's surrounded by a fibrinogen clot. Here it's attacked by antibodies, phagocytes, and the other defenses. Neutrophils are the chief enemy of bacteria. They accumulate in the injury site within an hour. After leaving the bloodstream, the neutrophils will be attracted by chemicals such as the bradykinins and the leukotrienes to the site of injury. This process is called chemotaxis. They're guided by chemicals. As they encounter the bacteria, the neutrophils will avidly phagocytose them and digest them, and then destroy many more by the respiratory bursts that we described earlier. They'll also secrete cytokines that then recruit macrophages and additional neutrophils to the site, again by chemotaxis. The macrophages and T cells will secrete colony-stimulating factors that stimulate leukopoiesis, so the production of more white blood cells, so we can bring them to the site of infection. We'll see neutrophilia when there's a bacterial infection, that is, an elevated neutrophil count, and eosinophilia when there's an allergy or parasitic infection. So simply by looking at someone's blood composition, we can tell whether they most likely have a bacterial or parasitic infection. So after we've mobilized defenses and contained and destroyed pathogens, it's time to clean up the tissue. The monocytes are the primary agents of tissue cleanup and repair. They'll arrive within about 8 to 12 hours, and then they become macrophages. This is where they engulf and destroy the bacteria, as well as damaged host cells and dead and dying neutrophils. Edema also contributes to tissue cleanup. The swelling compresses the veins and thus reduces venous drainage. This forces open the valves of the lymphatic capillaries and promotes lymphatic drainage. So the lymphatics will then collect and remove the bacteria, the dead cells, the proteins, and tissue debris much more effectively than blood capillaries. Now, we know that we see pus sometimes at the site of infection. The pus is simply an accumulation of dead neutrophils as well as bacteria and cellular debris, as well as tissue fluid. An abscess is an accumulation of pus in a tissue cavity. Pus is usually absorbed, but sometimes it forms a blister between the epidermis and dermis and may need to be released by rupturing the abscess. Blood platelets and endothelial cells in the area of the injury secrete platelet-derived growth factor. This stimulates fibroblasts to multiply and synthesize collagen. Hyperemia is going to deliver a lot of oxygen, amino acids, and other necessities for protein synthesis so we can rebuild the tissue. The increased heat also increases metabolic rate and thus speeds mitosis and tissue repair. The fibrin clot that was formed during the containment and destruction phase forms a scaffold for the tissue of reconstruction. And of course, the symptom of pain is going to make us limit the use of that body part so it has a chance to rest and heal more efficiently. So that brings us to the end of our section on nonspecific immunity. Take a moment here to outline the phases of inflammation, including the events that happen during mobilization of defenses, the events that happen during the containment and destruction phase, and then what happens during tissue cleanup and repair. Just make a brief outline. Once you have these processes outlined, you can refer back to them, have a quick reference, and understand precisely what's going on during inflammation.